We all sometimes experience numbness in our arms or legs. For example, when we sleep or sit in an uncomfortable position that compresses a nerve, the limb loses feeling. But simply changing position and moving around usually resolves it. However, there are times when fingers, hands, or feet go numb for no apparent reason. In this video, we'll explain the most common causes of numbness in hands, feet, or individual fingers. What can be done about it when it's not dangerous, and in which cases urgent medical attention is required. Carpal tunnel syndrome or tunnel syndrome. This is the most common cause of numbness in the hands and fingers. The median nerve of the arm extends from the spine through the entire arm, palm, and fingers. But at the base of the palm, it passes through a very narrow carpal tunnel formed by bones, ligaments, and tendons. When the carpal tunnel narrows, such as from injury, inflammation, or swelling of the wrist tissues, it compresses and injures the nerve, causing pain, tingling, and numbness in the fingers, as well as weakness in the hand. The median nerve provides sensation to the thumb, index finger, middle finger, and half of the ring finger, so numbness most often occurs in these areas. The wrist and forearm may also feel numb, especially at night. Tunnel syndrome develops in drivers, construction workers, pianists, but most often in people who work long hours at a computer. This is due to straining the hands in a bent position. When a person works with bent wrists for several hours a day, it traumatizes the carpal tunnel tissues and eventually leads to tunnel syndrome. It's recommended to use a special wrist rest pad for proper hand positioning. Many people purchase an ergonomic keyboard to avoid bending the wrists. Tunnel syndrome can also develop with certain medical conditions, including obesity, diabetes, rheumatoid arthritis, thyroid dysfunction, menopause, high blood pressure, wrist injuries and fractures, pregnancy. For tunnel syndrome, doctors prescribe a set of special exercises, sometimes applying a wrist splint. In particularly severe cases, when numbness is accompanied by severe pain, surgery may be required. Women are 3 times more likely to develop tunnel syndrome than men. Cubital tunnel syndrome. Everyone is familiar with the sensation when we accidentally bump our elbow and hit the hollow of the elbow joint. It feels like an electric shock from the elbow to the pinky and ring finger. In such cases, we hit the ulnar nerve that runs from the cervical vertebrae through the arm, providing sensation to the pinky and ring finger. At the elbow, it comes to the surface where it passes through the cubital tunnel, another narrow tunnel in the arm, only 4 millimeters wide. If numbness in the pinky, ring finger, and forearm becomes chronic, it means the ulnar nerve has been pinched in the cubital tunnel due to inflammation and formation of adhesions. Cubital tunnel syndrome is the second most common after carpal tunnel syndrome. It develops if a person is used to leaning on their elbows for long periods, sleeping with bent arms, or repeatedly making the same flexing and extending arm movements, as well as from elbow injuries. For cubital tunnel syndrome, doctors prescribe a set of special exercises. In rare cases, medication injections or surgery are prescribed. Tarsal tunnel syndrome compresses the tibial nerve in the tarsal tunnel located in the ankle. The syndrome manifests as numbness and tingling in the first 4 toes or the entire foot, including the heel. In advanced cases, the foot begins to hurt. Tarsal tunnel syndrome most commonly develops with injuries, sprains, arthritis, diabetes, flat feet, and varicose veins of the foot. Doctors usually prescribe injections to reduce swelling and inflammation, and in severe cases resort to surgery. Vitamin B12 deficiency leads to a serious problem. This vitamin is involved in forming myelin, the substance that creates the insulating sheath around nerve fibers. With chronic B12 deficiency, the nerve insulation breaks down, so nerve fibers transmit signals to the brain less effectively, leading to numbness, burning, tingling, muscle weakness, loss of reflexes, and even impaired balance over time. Any areas of the arms and legs can go numb. This often occurs in people with atrophic gastritis, where vitamin B12 is poorly absorbed. Diabetes. Numbness in the hands or feet is one of the main signs of diabetes. The numbness usually starts in the legs and feet, but can then spread to the hands, palms, fingers, and other body parts. While walking, a person may not be able to feel their legs. A person may feel like they're wearing a sock or glove. Excess blood sugar damages the myelin sheath of nerves that insulates nerve fibers. Increased blood pressure and impaired blood flow in small vessels also lead to impaired nerve sensitivity. A herniated disc in the cervical spine can develop slowly over many years without showing any symptoms. But if a herniated disc in the cervical region compresses a nerve root supplying the arm, a person may feel numbness or tingling in the hands, fingers, or parts of the arm. Usually only one arm is affected, either right or left. If a herniated disc occurs in the lumbar region, the leg may go numb. Sciatica. The sciatic nerve is the thickest nerve in our body. Starting in the lower spine, it runs from the spine through the buttock and thigh, branching into the lower leg and foot. When any part of the sciatic nerve is injured, a person feels numbness, tingling, or pins and needles in the leg or parts of it, including the foot. The numbness may be accompanied by pain and weakness. The most common causes of sciatica are osteochondrosis, injury, herniated disc, vertebral misalignment, and narrowing of the spinal canal. If numbness in the leg occurs after a serious injury, or if numbness is accompanied by sudden and excruciating pain, an ambulance should be called immediately. Multiple sclerosis. In multiple sclerosis, the immune system attacks the nerve's myelin sheath, which disrupts the limb's connection to the brain. This results in numbness or weakness in the arms and legs, usually on one side of the body, either right or left. Usually, one leg is affected, less often both legs along with the torso. Multiple sclerosis has no cure. However, with timely medical attention, the symptoms can be mitigated. Stroke. Numbness can be very dangerous if it is caused by an impending stroke. Sudden weakness or numbness in the arms, legs, or face is a typical sign of a stroke, especially if it occurs on only one side of the body. Typical signs of stroke. One side of the face droops. When attempting to raise both arms, one arm rises with difficulty. With numbness, a person has difficulty speaking and confusion occurs. An ambulance should be called immediately for these symptoms. Brain tumor. Brain tumors can also cause numbness in arms or legs, more often on only one side of the body. A tumor is indicated by the addition of severe headache, fainting, confusion, shortness of breath. In such cases, the person needs urgent medical attention. Shingles. Numbness, oddly enough, can be caused by shingles. It can be contracted through contact with someone who has chickenpox. It can appear on any part of the body, including individual fingers, forearms, shoulders, legs, and feet. At first, the person begins to feel numbness, itching or tingling on the surface of the skin. After about 5 days, a red rash appears, which then turns into fluid-filled blisters. Shingles is caused by the varicella zoster virus. It lasts from 3 to 5 weeks. Usually, shingles goes away on its own, but sometimes there are complications in the form of meningitis, encephalitis, and pneumonia. Pregnancy. During pregnancy, women feel numbness in their hands and fingers, especially in the mornings. In pregnant women, especially in the 3rd trimester, the heavy uterus presses on the nerve trunks of the legs, which often causes numbness and tingling in the feet and toes. Also, carpal tunnel syndrome is often caused by swelling compressing the nerves. After childbirth, numbness usually goes away immediately, though in rare cases the limbs may continue to be numb for some time. Other causes of numbness. Dislocation of the vertebrae or a spinal tumor can lead to numbness of the arm or leg, depending on the location of the pathology. Thyroid problems. Hypothyroidism can cause swelling that compresses nerves and causes numbness in the fingers, hands, or feet. Carpal tunnel syndrome is particularly common. Lyme disease, which is contracted through tick bites, often causes numbness in the hands and feet, as well as pain and weakness in the limbs. Numbness in the hands and feet also occurs with fibromyalgia, osteoarthritis, vasculitis, alcoholism, and poisoning. When should an ambulance be called in cases of numbness? An ambulance should be called immediately if a person is experiencing numbness of the entire arm or leg, confusion, numbness after a recent head injury, sudden headache. The numbness comes on suddenly. Speech difficulties, chest pain, difficulty breathing, weakness, or paralysis. Schedule routine doctor's appointments for the following symptoms. Only part of a limb, such as fingers, is numb. The numbness gets progressively worse for no apparent reason. The numbness is aggravated by repetitive movements, such as working at a computer.
This content is for informational and educational purposes only. Consult with a doctor or healthcare professional before following any recommendations provided in this video. Tell us about your experience in the comments and subscribe to our channel.